The Ottawa foot and ankle rules are used to determine if radiographs should be taken after an injury. Were you able to walk after your injury?
No.
Okay. Do you have any pain here along the distal 6 centimeters of your posterior lateral malleolus?
Yeah.
Do you have any pain here at the base of your fifth bed?
Yeah.
Do you have any pain here on your medial malleolus?
No.
Do you have any pain here at your navicular?
No.
Okay. Well, the places you're tender and your inability to bear weight after your injury, I think you should go and have radiographs taken. There are 4 items in the test item cluster for patients that are likely to respond to spinal stabilization exercises. They are age, aberrant motion, straight leg raise, and a positive prone instability test. Are you less than 40?
Yes.
All right. And then can I have you bend forward and touch your toes, please? The patient is positive for aberrant motion due to the observation of a Gower sign. I'm going to have you lay here with your chest and stomach on the table and your feet on the floor. You can hang on. And, all right, I'm going to push on your lumbar spine, applying some posterior anterior pressure. Do you have any pain with this?
Yeah.
All right, I'm going to go ahead and have you lift your feet up. Hang on to keep yourself on the table. All right, I'm going to apply some pressure again. You're having any pain now?
No.
All right. The patient has a positive prone instability test. I'm going to have you lay up here on the table with your face up. Good job. I'm going to flex your hip, extending your knee for the straight leg raise, and the patient has a average straight leg raise of greater than 91 degrees. There are 5 components in the test item cluster for patients who are likely to respond to spinal manipulation. The first is duration of symptoms is less than 16 days. The second is no symptoms distal to the knee. The third is an FABQ work subscale score of less than 19. The fourth is at least 1 hypomobile segment in the lumbar spine. And the fifth is at least 1 hip with greater than 35 degrees of internal rotation. McMurray's test is used to assess the integrity of the meniscus. Be fully flexed. Here, internally rotate tibia to assess the lateral meniscus and extend the knee. Ooh, you clumped. Rotate. And we're done. I'm going to perform the Lachman test in order to assess the integrity of the ACL. It assesses the amount of anterior translation of the tibia in relation to the femur. It's important to test both sides, starting with the uninvolved limb. So we're going to start with the knee. On the uninvolved side, flex to approximately 30 degrees. I'm going to stabilize the femur and then apply an anterior directed force with my hand at the back of the proximal tibia. I'm going to then test the involved side, where the knee is again flexed to approximately 30 degrees. One hand stabilizing the femur, and the other applying an anterior directed force on the tibia. If the M feel is the same on both sides, it indicates a negative test. However, if there is greater tibial translation, then it indicates a positive test for the Lachmans. Straight leg test is used to assess the mobility of the meninges, peripheral nerves, and other surrounding tissues. Any pain?
No.
Done. The test item cluster used to determine if a patient is likely to have hip A contains 5 components. The first is self-reported pain with squatting. The second is lateral pain with active hip flexion. The third is pain with active hip extension. The fourth is hip internal rotation of less than 25 degrees. And the fifth is lateral or anterior pain with the Scour test. Just lay down and we'll do the Scour test. All right. And then I'll apply pressure if there's any pain. All right, and then roll over on your stomach and I'll do internal rotation. Weber is used to determine pathology in the hip and or the SI joint. With the patient supine, the test leg foot is placed on top of the opposite knee, slowly lowering the test leg knee to the table. If it becomes parallel, you can apply pressure. If it's painful, it indicates a positive test. The inability to get parallel with the opposite leg also indicates a positive test. The anterior drawer test of the ankle is used to assess the talofibular ligament. There are multiple tests to differentiate between an L5-S1 radiculopathy versus a gluteal hamstring weakness. With radiculopathy, there will be a myotomal weakness of the plantar flexors and great toe extensors. Pull this toe up towards your nose. I don't want to push it down. Good job. You can also assess plantar flexion weakness with a single leg calf raises. There would also be diminished Achilles reflex. There we go. And there could possibly be sensory deficits in an L5-S1 dermatome with the radiculopathy. There could also be a positive straight leg test, well leg, or slump test. With a gluteal hamstring weakness, there would be no dermatomal or myotomal deficits.